Okay. For the pediatric infant examination, you have an infant. He's here for a well baby checkup. Well baby checkup, the patient does not have any problem. He's here for an immunization. You just check him whether everything is going right or not. So you start off with the head to toe examination. From head to toe, you will see the look, inspection, the child is syndromic or not, like Down syndrome, like Turner syndrome. You see the eyes, medial apicanthal folds, you see the nose, nostrils, you see the forehead, general appearance, ears, is it low lying or not low lying, neck or the webs or not. So this is on general inspection, your impression. Then you start off with the head. You start off with the head as whether the child has head normal or not. Then this is for anterior fontanelle, whether is it open or not, is it closed, is it open, is it wide or is it narrow, is it depressed or is it bulging. If it is bulging, then what happens? Hydrocephalus. If it is depressed, dehydration. If it is widely open, okay, what is the role? You measure the anterior fontanelle. If it is 1.5, your one finger line is approximately 1.5 centimeter. So if it is greater than that, maybe 2 or 2.5, it is a wide anterior fontanelles. The causes for the wide anterior fontanelle: hypothyroidism, vitamin D deficiencies, rickets. So you need to comment on anterior fontanelle. Then you will need to comment on the forehead, whether is it bulging or not. Okay. And then you need to comment on the eyes. The eyes are does it have any apicanthal fold or is it normal, or and on the eyes you also need to demonstrate the eye that the child is fixing eyes to somewhere or is it just wandering. So you can have an idea, okay, the child can see or not. You should do the after the red reflex, demonstrate the red reflex. If the red reflex is absent, then retinoblastoma or congenital cataract. Yes. Yeah, you can comment on the nose, and then you need to comment on the mouth. You should do this. In order to, this is the rooting reflex. When you do this, the child will move his mouth towards your finger. So this is rooting reflex. Then you put your middle finger inside the mouth, and then you see whether there is any cleft palate or not. Whenever you start rubbing the hard palate, the child started to suckle. So this is a suckling reflex. So you check for the suckling reflex, you check for the palates are cleft palate or not, or anything that you can observe. And the neck, you have a comment on whether web-shaped neck or not. Then comment on the inspection of the chest. The chest is moving, or does it have any palpation or anything like that. You can also palpate for any tenderness. You should auscultate for any crepitations. You should also auscultate for any added sounds in the cardiovascular thing. So it's just a well baby examination, does not need to have everything extensively. You just need to go from head to toe. So you check, have a comment on auscultation for the chest, comment on auscultation for the precordium for any added sounds. Abdomen, you need to palpate it for any visceromegalis, liver and spleen, or comment on the umbilicus, bulging, not bulging, any visible pulsations, caput medusae and things like that. And then you go downwards, you have a comment on the genitalias, whether genitalias are ambiguous or not, or is it male, female. If it is female, vagina openings is open or not, male, testis descended or not, penis have hypospadiasis or epispadiasis or not, for the males. And then you need to comment on the inguinal areas for any inguinal hernial orifices, whether the child is moving all the 4 limbs or not. Probably he is not doing one limb, is not he is not moving one limb, so you may expect some dislocation happens during the pregnancy, during the birth. And then you go downwards. This is for we covered abdomen, we covered genital area, we covered inguinal area, and then we need to comment on the developmental developmental dysplasia of the hip joint. You want to see whether the patient has any hip joint is present, is good or not. So this is Ortolani's and Barlow's and Ortolani's maneuver. What is it? For fingers and index finger, you will put it here in the buttock area. Your thumb, you need to hold the thumb from the knees. Then you will flex it, alright, and then you will do abduct it. So this is how you're going to dislocate the hip joint. And then when you do adduction and flexion, you actually relocate the joint. If you find a click, this is an abnormal thing. You need to refer the child because the child may have some dysplasia of the hip joint, and at this age you can miss this. There would be no pain for the child, but when he grows up and goes up to in the walking age, 2 months, 2 years, 5 years, and then he started limping, and at that time you may want they go to the orthopedic, and then they will find out that okay, the patient may have this dysplasia at the birth, and now is it manifesting, and it will be very difficult at that time to manage that. So this is the age where you need to refer and to the orthopedic to manage their condition.
Normally there will be no dislocation by the first movement.
Yeah, if there is no, if you don't find a click, if you don't hear a click, that means it's okay. You perform it on the one limb and then you perform it on the other limb, or you can do it both at the same time, whatever is convenient for you. Okay, but if whenever you find a limb, you need to refer the child, or you need to do an ultrasound of the hip joint to see there is any dysplasia or not. Yeah. Condition? Ortolani's and Barlow's maneuver. Yes, this is one maneuver, Barlow's, and Ortolani's is actually to fix it up. Alright, you can also, it's also mentioned in the Oxford GP also, you can also look up that. Okay, for the foot, you need to see whether the fingers are good. Does it have any flat foot or not? Okay, hands also. What are the signs for the rickets?
Bowing of the leg.
Bowing of the leg, good. Widening of the wrist, very good.
Rosary.
Frontal bossing, ricket rosaries. So on the chest, you should also see the signs for the rickets generally. Then when you prone the child, you can see the head leg. The child can do like that. So you see that okay, the head legs are good. And then you have a comment on the back. The spine is straight. There are no bulgings. There are no deformities. Neural tube defects may have some spina bifida or not. The anal orifice is open or not. This is from the back. You will do it like that, and then at the end you will just fall the child like this. And this is for the Moro's reflex. This would be your last thing that you will do. After that, the child will start crying. So with this crying, you should not do as after you do Moro's and then you start to auscultate the child for the chest. It's not a good idea. While you're doing the child, you should auscultate it before. While you do the thing, this is the last thing. The child will start crying. When he starts crying, you should observe that okay, the child is now moving all the four limbs, good. And you can also have a look on the inguinal region, because when the child started to cry, he may have some bulgings in the inguinal region. So you don't ask the child to cough so that it can bulge it out. So for the children, you will do this Moro's reflex, and then when they cry down, you see the inguinal region, okay, there are no hernial orifices. These are all things that you as a family physician should screen that up, because neither the woman, neither the mother nor the parent is going to realize that the patient has this developmental dysplasia of the hip joint, or he has congenital cataract, or he has inguinal orifices. Sometimes they observe that and sometimes they don't. And probably that the testes are descended or not in the males. So these are all things that you need to comment on the well baby examination. Feeding advices are also very important. You should also give the child feeding advices, breastfeed and exclusive breastfeeds, and then weaning advices. These are also an important aspects of the child and pediatric nutrition. So that's it. We've covered all the aspects. I tried to cover all the aspects